Good afternoon, everyone. It is July 11th, 2022. Thank you for joining us for this update on monkeypox. I'm Kristen Shanahan, the Public Information Officer for the Louisville Metro Department of Public Health and Wellness. Today, we are joined by Dr. Jeffrey Howard, Interim Director and Medical Director of Louisville Metro Department of Public Health and Wellness. And Dr. Howard will be providing an update on monkeypox, and then we will be turning it over to you for questions. When we get to questions, I will call on you one by one, or you can feel free to put your questions in the chat. Until the question portion, please make your devices, please make sure your devices are muted. With that, we will now turn it over to Dr. Howard for the update. Dr. Howard.
Well, good afternoon, everyone, and we really appreciate each of you joining us today for this update on monkeypox. As I'm sure you're aware, monkeypox has been spreading across the world with increasing cases in the United States over the last month. We have currently, as of today, 3 cases in the Jefferson County area. And for that reason, we wanted to provide an update to you, our media colleagues, as well as to the general public of Jefferson County so folks are aware. Because what we know from COVID-19 is that people are hyper acutely aware of infectious diseases and the risks that they pose to themselves. So for that reason, we wanted to make sure that people had the information available about monkeypox. Monkeypox is a virus that is in the realm of orthopox, similar to smallpox. It tends to spread via close in-person contact. Unlike COVID-19, it does not spread as readily through respiratory droplets and therefore is not quite as contagious. For example, monkeypox is thought that one person contracting the disease may spread the virus to 1 or 2 other people, whereas the Omicron variant of COVID-19, one person with that disease might spread it to 9 or 10 people, so much less contagious. However, it is still contagious. The monkeypox virus tends to spread via close in-person contact with someone who is infected with this illness. They tend to shed this virus in the bodily fluids. This includes from the sores that people get, from saliva and other bodily secretions. Many folks are aware that this virus tends to spread amongst gay men, bisexual men, and other men who have sex with men. However, the general public can contract monkeypox virus and is not limited to just men who have sex with men. The Louisville Metro Health Department is working very closely with our LGBTQ+ community to make them aware that this virus is out there and help them adopt preventative measures. We also wanted to let the general public know about what symptoms there are of monkeypox and how they can prevent it. The general symptoms of monkeypox are fever, headache, muscle aches, swollen lymph nodes, chills, exhaustion, so general flu-like symptoms, plus a rash. A rash that can involve the mucous membranes, it can involve the genitalia, and the whole skin in general. This rash may look like pimples or little blisters, and they will eventually drain fluid and then scab over. Contact with this rash can spread the virus. So, with all that said, what can the general public do to sort of prevent the spread of this virus? As of now, the CDC is not recommending masking because this does not spread from a respiratory standpoint, except for those who have the virus. They should wear a mask to prevent spread to nearby contacts or certain healthcare providers who may be in contact with people with monkeypox. But in general, the general public, per the CDC guidelines, are not currently recommended to mask to prevent the spread of monkeypox. What you should do, what someone should do if they think they have monkeypox, if they display the symptoms I mentioned earlier, develop a rash, they should isolate themselves to prevent the spread to other people and contact their healthcare provider. When seeing their healthcare provider, they should remind them that monkeypox is spreading in the community and that perhaps they should be tested as determined by their healthcare provider. We at the Louisville Metro Health Department are working with our healthcare community to perform contact tracing, to let close contacts know, and then we also have a limited supply of vaccinations as well as treatment available for those who are close contacts or contract this illness. In general, monkeypox is not a very deadly virus with a survival rate of more than 99%, and symptoms are usually fairly mild for most people. Those that are at greatest risk are those that are immunocompromised, and then in those situations, this virus could be fatal. Again, we believe that the risk of spread to the general public is low, The CDC has stated that the risk for the general public within the United States is low. And based on that information, and in conjunction with our experts at the CDC and state level, we feel like the risk of spread to those in Jefferson County in general is pretty low. As mentioned, we currently have 3 cases in Jefferson County. All 3 cases are working closely with our team. We have performed contact tracing. We have initiated treatment where appropriate and vaccinated those people that we have identified as close contacts per the CDC recommendation. We're happy to report that all these contacts are participating with us and have been active participants in their own care. Again, we think that the risk to the general public is fairly low at this standpoint, but given the awareness that COVID-19 has brought to viral infections and our susceptibility to viral infections, we wanted to make sure you guys had the opportunity to have the information you need to inform the public about this illness. With that said, I'll pause and we'll take some questions.
All right, Paul, let's start with you first.
Yeah, hi. Hello, doctor. Thanks for taking our questions. These 3 cases, these people recovered?
These folks are in the recovery process. Let me introduce while we're here Dr. Stephanie Lockett. Dr. Lockett is a nurse practitioner and our director of nursing. She has worked very closely with these individuals and has helped direct their treatment along with their physicians. And she will be able to give a more precise update on their current treatment. But my general understanding now is they have all participated in their care and they're all recovering and convalescing quite well. Dr. Lockett, you have any comments on that?
So one of the individuals has actually been released from isolation. The other 2 continue to work closely with the health department and are recovering at home as well.
And can you give any details as to the length of recovery and what kind of treatment these people receive when they get monkeypox?
So there is treatment available. It is an investigational drug, but is something that can be provided if a patient meets certain criteria, having lesions in certain areas of the body, or also having underlying health conditions that may predispose them to having a worse course of illness. As far as the recovery period is determined by each individual. You should be isolated until the lesions have scabbed over, the scab has come off, and there's new skin formed there. So for some people, it may be a shorter period of time than others.
And Dr. Howard, you alluded to this, but let me ask you again, why are you doing this Zoom conference with us? Is there a fear that you're hearing among people out there that of monkeypox? Is it the name? Well, what is it that has prompted you to get this word out to either one of you?
Well, I think first off, COVID-19 has made people very aware of our susceptibility to viral illnesses, and people want information about potential spread of infectious diseases in our community, and they want it early on. And we just, as a LMPHD, we just want to make sure we're providing people with information that so that they know what is going on, so that they're aware of their personal risk and can make personal health care decisions based on their personal risk and the information available to them. Again, I want to reiterate, we're not doing this press conference today because we think that the risk to the general public from monkeypox is high. In fact, we, based off the CDC's experts' information, we believe the risk to the general spread in the United States is low. And we believe that the risk of spread within the Jefferson County area and the Louisville metro area is low. But we do want to make sure people have the information available to them as we go on, and mostly want to make sure they know that what is available to them. I will tell you, once the spread of monkeypox began in the Jefferson County area, the health department was inundated with calls. And so that suggests to me that the general public is concerned and wants information.
Thank you all.
Thank you, Paul. Jess Clark with WFPL.
Hi, thanks, Dr. Howard. Yeah, I guess, can you talk a little bit more about the impact on gay men and bisexual men? I just kind of want to untangle that a little bit so nobody gets the wrong idea about why particular populations are more susceptible than others to this particular illness. Can you please kind of explain that more in depth, please?
What I can tell you now is that the early data from the CDC suggests that this virus spreads particularly amongst gay men, bisexual men, and other men who have sex with men. I want to be clear though, anybody can get monkeypox if they're exposed to it. And what I can tell you is we are working closely with our LGBTQ plus communities and the various partnerships we have with them in the community to ensure that they're aware of this illness. But again, I want to reiterate, the general public can get this virus if they're in contact, and it is not isolated to gay men.
Okay. Any sense of where these individuals contracted the virus? Do we know?
That is not 100% clear to me yet. I'll let Dr. Lockett's comment in a moment. I will tell you, one is a resident of the Jefferson County area. Both the others, my understanding, Dr. Lockett's correct me if this is incorrect, but my understanding is that the other two contracted it elsewhere or are from elsewhere, but are under our supervision.
Correct. So we do believe that one potentially contracted it here in the Louisville metro area. The other two have a travel history that indicates to us that potentially they contracted it elsewhere.
And so did they get it from each other, or they're all separate kind of incidents?
Right. So at this point, there is no correlation between the three cases.
Dr. Howard, this is Paul again. Is there a vaccine for this or a vaccine in the works?
Paul, sorry, I was having a bit of a technical delay there, but I heard your question. Yes, there is a vaccine available. The Louisville Metro Health Department, we are in possession of a small quantity of this vaccine. Currently, the Centers for Disease Control does not recommend mass vaccination for this illness like COVID-19, but rather just for those with close contacts or a particular risk.
Yeah, that was my next question. Who should get the vaccine?
Stephanie, Dr. Lockett, you want to comment on exactly precisely who should get the vaccine?
Sure. So at this point, the vaccine is suggested for those who have what we classify as a high level of close contact with an individual and who have significant risk factors for disease. So the CDC is very kind of limited on who should receive the vaccine at this point. And so those folks that we have vaccinated have been close contacts of the individuals who have tested positive.
Sarah Ladd with the Courier-Journal.
Yeah, thanks both of you for being here today and answering these questions. So my first question is about the contact tracing and how many people have come in contact total with the 3 patients.
Dr. Lockett, are you aware of how many people we have contact traced? I do not know that exact number, Sarah.
I don't have the exact number, but I can say that it's been a relatively small number for each of the individuals. No more than 5 per case that we have had to reach out to for contact tracing at this point.
Perfect. And I also wanted to ask about the severity of the cases. I don't know if you can talk a little bit about what symptoms we saw specifically with these here. You know, were they very bad cases? A little bit about how severe these patients had it.
Go ahead, Dr. Lockett.
All of our cases have been able to recover outside of the hospital for the most part. None of them have had significant complications. However, all of them have had a classic rash that we would associate with the virus and the other symptoms that Dr. Howard alluded to, including the flu-like symptoms as well.
Thank you. And I also wanted to just confirm one thing. I think I understand this correctly, but just to confirm. So cis men who have sex with men are the most at risk, but this is not an STD, correct?
This virus, sorry, it's a great question. So this virus can spread via sexual contact, but it is not limited to sexual contact. So for example, If someone were shedding the virus through open wounds and you had prolonged skin-to-skin contact with someone, you could contract the virus from that skin-to-skin contact. If you were to share clothes with someone shedding the virus through blisters, you could contract it that way. Does that make sense?
Yeah, I think so. And I think that's all I've got for now. So thank you.
Thank you.
All right, Jennifer with WLKY, are you on?
Yes, I'm here. Can you hear me?
Yes, you can go ahead
Okay.
and ask your questions.
So the New York Times is reporting that the World Health Organization, an expert from there, said that while airborne transmission of monkeypox appears to be uncommon, it is possible. Can you speak to those possible concerns that people should be aware of as far as airborne transmission goes?
Yeah, I think in the era of COVID-19, we're all certainly worried about airborne transmission and our risk. What I would tell the general public is we here at the Louisville Metro Health Department follow the guidelines from the expert at the Centers for Disease Control. They're really the infectious disease experts that are going to define policy, define masking recommendations that then will trickle down to us at both the state and local level. Currently, the CDC is not recommending universal masking for the prevention of monkeypox. However, here at LMPHW, we're going to continue to closely monitor the situation. And should the CDC or others make a different recommendation, then we will consider that. We will consider that here, Jennifer. That's an excellent question, and I think it's on the minds of a lot of people.
Thank you.
Yep.
All right, now let's go to Jose with Aldea.
Yes, I just wanted to know if you know from which countries or places the two individuals got the virus, the ones that are not from Jefferson.
I know that one of the gentlemen or one of the folks who had it had traveled fairly broadly. Stephanie, what do you know much information about the other one's travel history?
One of the individuals, as Dr. Howard alluded to, had done some international travel. The other has done a large amount of travel within the United States.
Thanks.
All right, let's go to Wave News. All right, WDRB. Anybody on with Spectrum News 1? What about WHAS 11? Okay, it looks like Sarah Ladd had an additional question. Sarah, you can go ahead and ask.
Yeah, I just wanted to see if y'all knew how many doses of that vaccine we had. I know you said it's a small quantity. Just curious what the total is, if you know.
Stephanie, do you know how many we have left? I don't know the exact answer to that according to how much we've given out in the over the weekend.
So originally we had 20 courses of vaccine shipped to the city. Currently we have 10 courses remaining. And then we are able to request some additional doses from the state as needed, and they have some in a stockpile as well.
Dr. Lockett, you want to talk a little bit about the full vaccine course and then when people are considered fully immune?
Sure. So the vaccination is actually a 2-vaccine series unless the individual has been vaccinated for smallpox in the past, or if they have a military history, as it's considered extremely likely that they were vaccinated against smallpox in that venture. So the vaccine is given 2 doses, 8 weeks apart. And then about 2 weeks after that is when they would be considered to be fully immune.
All right, and we'll go back to Jess Clark.
Hi, this is I saw another person had this question as well. Catalina Cordova. What is the school system and private schools? What are they doing, if anything, to prepare for, the introduction of this virus into the community ahead of the start of school?
So as part of our usual LMPHW routine work. We're working closely with our contacts at the school system. Let them know that this virus is spreading. Currently, there's no recommendations right now from the Centers for Disease Control for school-specific spread. What we know is that typical school populations are at low risk. Children are at relatively low risk, and the general population that will be school age will be generally low risk. However, we're going to be working with them closely as we get closer to the start of school to make sure that our school nurses and other folks that are going to be taking care of the pediatric populations are aware of what signs and symptoms of monkeypox look like, and that should a case arise, that we'll be ready to respond appropriately.
All right, Paul, and I believe you had another question as well.
Stephanie's already answered it about the dose regimen. Thanks.
Dr. Lockus, would you mind to take a moment to just talk about the TPOXX treatment? TPOXX is traditionally a treatment for smallpox that is being utilized. You mentioned earlier that it was for certain subsets. You just want to review that for everyone?
Sure. So the TPOXX treatment is an oral medication is what we have on hand here in Louisville. And basically it's the length of treatment is determined by the severity of symptoms and the number of days that you've already been infected. It is recommended for those individuals who may have a significant health history, such as potentially HIV infection or other illnesses that can make their immune system function at a less than optimal level. And the medication is taken weight-based to determine exactly what your dose would be for the day, typically twice a day, and the typical regimen is 14 days.
Great. And we had another question from Jose with Aldea. He asked, is it possible for a person sitting with another for several hours on a flight to get monkeypox? Dr. Howard, if you want to start.
Yeah, the short answer to that question is yes. If that person's actively shedding the virus, then yes, you could contract it with them being in a close contact for a prolonged period of time, such as a prolonged flight.
All right, thank you. Any other questions related to monkeypox? All right, and it looks like Jennifer with WLKY had a non-monkeypox question. She would like to get a brief update on the current COVID situation in Jefferson County. Dr. Howard.
Yeah, so we are still in the yellow category. Our cases, I have not looked at today's cases yet, so I typically get a case report on Monday that I'll review. I haven't reviewed that yet today. However, as of at the end of last week, we were still in the yellow. We were seeing predominantly the BA.5 virus. For those of you following our wastewater data, and if you're not, I strongly suggest you do. And Kristen, let's share the link to the wastewater data in our chat. But the wastewater information is quite interesting and is really a valuable tool for monitoring infectious disease. And what we're seeing is the BA.5 variant took over in the wastewater data in really a remarkable period of time and quickly replaced the BA.2 Omicron variants that we were seeing early on. BA.5 is thought to be highly contagious, perhaps even more so than the BA.2 Omicron variants that we were seeing before. There's no evidence at this point that it contracts any more significant illness, and that is congruent with the level state of hospitalizations that we're seeing in our community. There is some anecdotal evidence, early evidence, if you will, that has shown that perhaps the BA.5 variant is less susceptible or less prevented by vaccination. However, vaccination and getting fully vaccinated, including boosters, is the best tool that we have to prevent this infection, and still prevents many infections and still prevents severe illness if the illness is contracted. But we do believe the BA.5 variant is the dominant variant in the Jefferson County area. You may have seen news recently that in India, the BA 2.75 Omicron variant is spreading rapidly. We were watching that closely, and there is some cases in the United States. As far as I'm aware, we have not had any of those in the Jefferson County area, but it is thought to be highly contagious subvariant as well. The bottom line here is that COVID-19 isn't over. We're going to continue to see variants for the foreseeable future. Folks need to modify their risk. We still are not fully, we're still sitting between 66 and 70% of people who are fully vaccinated in the Jefferson County area. So we still have some room for improvement. And the best way to prevent this illness, prevent contracting a severe form of COVID, is to get vaccinated and boosted. So we're still encouraging people, please get vaccinated. If you feel like you develop symptoms of COVID-19, please isolate yourself and get tested. In fact, I think it's fair to say that those of you who interviewed me before probably can tell my voice is a little hoarse and maybe strained a little bit. I contracted an illness late last week. I don't know if it's COVID-19. I took 2 at-home tests 48 hours apart. Both were negative. I had a formal COVID PCR performed on Saturday. I don't have the results yet, but that's why we're doing this interview from home. So I encourage people that if you think you have this illness, do exactly what I did. Stay home. Avoid exposing others to COVID-19, and make responsible decisions for your own health.
And it looks like Paul has a follow-up question when it comes to COVID-19.
Yeah,
Yes.
Doctor, many of us,
Sorry, Paul. Kristen, this had to be our last one because I got to jump over to the FAB meeting.
Okay, you got it.
yeah, Doctor, thanks. Many of us received the two shots and the booster last year. At what point do we need to start thinking about getting more shots because of this spread of the BA5?
No, Paul, what we're going to do is we're going to follow the or the CDC's recommendation on when repeat boosters can be allowed. We can provide that information, Kristen, if we don't mind to provide that in the chat. But the bottom line is, I expect, and I think most healthcare experts expect that COVID-19 is going to become a routine vaccination that is almost like our flu shot that we're going to get on a relatively frequent basis. Some of the reason that we are seeing the spread of continuing to see the spread of COVID-19 is, one, the new viruses are developing spike proteins and other mechanisms that allow it to evade our immune system, even if we're vaccinated and we develop immunity. And then two, there's some waning immunity, especially to those mRNA vaccines. And so what I expect to see is scientists, much like we do the flu vaccine every year, are going to have to spend some time trying to predict what future variants are going to come down the line. Same way we do the flu vaccine every year. They try to predict what strains of flu are going to come out. And sometimes their guesses are better than others, but these are educated scientific guesses. And we'll get vaccines that are hopefully be predictive in nature and prevent future variants. I expect that's what's going to be coming down the line. And I know the virologists and other experts in this area at the CDC are working on it.
Thank you, Dr. Howard. I know you have to jump off to catch another meeting. Dr. Lockett, we have a few people asking about your credentials. I put it in the chat, but if you want to go ahead and introduce yourself too and give them the correct pronunciation of your name.
Yes, so I am Dr. Stephanie Lockett. I am a nurse practitioner, so my credential is Doctorate of Nursing Practice and a family nurse practitioner. I'm the Assistant Director of Nursing for Louisville Metro Public Health and Wellness. And again, it's Lockett, just like a locket that you would wear. So.
Thank you so much, Dr. Lockett. Thank you, everyone, for your time today. I did include a link in the chat. If you take a look up, I'll copy and paste the link again. But we have more information about monkeypox on our website, and then feel free to reach out with any questions that you have. Thank you so much, and everyone have a good day.
Thanks.